Good morning, ma'am, and good morning, my dear friends. Myself, Mrs.K. Aruna, M.sc first year, Department of Mental Health Nursing, Holy Mary College of Nursing, Hyderabad. So today I want to discuss a case presentation on phobic anxiety disorder. Okay, the phobic anxiety disorder. Here comes the introduction of the patient. The first we'll move on to the history collection. Means we need to collect the history from the patient soon after the admission. Okay, so here the patient, as a part of my clinical postings, I was posted in psychiatric hospital in the psychiatric ward. So I took the case of Miss Sridevi, the age of 16 years of old. She was admitted in the psychiatric ward on 16th February 2020 with the chief complaints of sweating, confusion, and the palpitations and urinary urgency. Okay, these are the chief complaints when the Sridevi has admitted in the hospitals. Then we'll move on to the patient profile. Okay, the name of the patient is Sridevi. The age of the patient is 16 years. The sex is female. Then the IP number is 13018. The unit or ward is OP psychiatric ward. The education of the patient is 9th standard. The occupation is nil. The income is nil and religion is Hindu. The date of admission, the date of admission is 16th 2nd 2020. The diagnosis of the patient is phobic anxiety disorder. Then the address of the patient, she has come from Jyoti Nagar, Karminagar, Telangana. Then the mode, date of case was started on 20 February 2020. Then the date of care was ended on 15th 3rd 2020. The informant is mother. The reliability is true reliable. Then next we'll move on to the presenting chief complaints. Okay, present chief complaints are like when she admitted in the hospital. So she has complaining that when I asked the patient, so she has complaining that. So patient says that she's having sweatings, excessive sweatings and cold and palpitations and clammy hands and diarrhea and even urinary urgency. Then when I asked the patient's mother, like informant, so according to the mother says that she's having bruising and muscle tension and trembling, and the hands and voice is trembling voice of hands and increased anxiety, and she used to feel embarrassment. Okay, embarrassment, when even she unable to communicate with other people, she unable to talk with other people except the family members. When she want to communicate with other people, even the friends also, she used to feel some type of anxious. She used to feel urinary urgency. She used to feel palpitations. She used to feel embarrassment. So we have after knowing, after checking all the history and all, after taking all the chief complaints and all, even doctors also confirmed that she is having social phobia. Under the phobic anxiety disorder, she is having a social phobia. Then the history of present illness. Okay, present illness is the time of onset is Miss Sridevi as admitted in the hospital on 16th 2nd 2020 at 10 o'clock a.m. The chronological order of the symptoms are Miss Sridevi is she started phobic symptoms since 2012. She had the symptoms of anxiety, palpitations and the tension when she interacted with other people. In 2013 she developed symptoms like diarrhea and urinary urgency, and she unable to talk with other people. When she talks with, she used to feel urinary urgency, she used to feel anxious and diarrhea. In 2017 she 2018 she developed some symptoms embarrassment and clammy hands, and even she is having she used to have some type of palpitations when she unable to talk with even relatives also. Then the reason of the hospitalization is here Miss Sridevi admitted in the hospital due to social phobia. According to the mother's statement, the patient used to get scared if she go out, and she unable to talk with any other people. She unable to even communicate with the relatives except the family members, and even she go out of the house, she feels anxious, tension, palpitations, and there is like there is no eye to eye contact with even the family members, or even she don't have any eye to eye contact, or she don't have any communication skills. And the parents, so soon after when they observed this all those things, even soon after they have taken the Sridevi to the counselor. There is after giving some sort of counselings and all, she used to feel better till 1 month, but after later on again the symptoms has been started. So then in 2019, once they have taken to a psychiatrist even for therapies, but there is no use for that also. Then in 2020 she developed elevated symptoms, so that is the what they brought Sridevi to psychiatric hospital for admission. So duration of the symptoms are since 8 years she is suffering with these symptoms. Then the medical and surgical history. So here the present medical history is the patient is suffering from diarrhea, excessive urination, cold hands and headache. The past medical history is she went to Rush Hospital in 2014 due to migraine headache. The present surgical history is nil significant. The past surgical history is nil significant. Then the present psychiatric history. Here comes the present psychiatric history, like all the precipitating factors, predisposing factors and all. The Miss Sridevi admitted in psychiatric hospital on 16th February 2020 due to confusion, anticipatory anxiety, trembling voice and hands and fear and depression. And since from her birth till 5 years there are no changes in her behavior. Then when she started to go for the schooling, and she unable to communicate with friends, and even the teachers also have given counselings many times, but there is no changes in that. And even the teachers, after the teachers have informed to the parents when she is developing these sort of symptoms. Then the symptoms used to be there when she exposed with other people except family members. And at last parents have brought her to psychiatric hospital, and here Dr. Catherine is giving care for the Sridevi. And after done of all the assessment, history collection, physical examination and mental status examination, and all of investigations, and even Dr. Catherine has diagnosed as a phobic anxiety disorder, that is social phobia. Okay, so the treatment is giving anti-anxiety medications, that is injection diazepam, and antidepressants also injection tablet is fluoxamine and all. So the past psychiatric history, the parents have taken her to psychiatric hospital in 2019 for the counseling at Secunderabad. And the family history is she's having grandparents Murthy, and Murthy is the grandfather and Suguna is the grandmother. And there are no other communicable diseases, non-communicable diseases. There is no hypertension, TB and diabetes mellitus and all. All the family members are having a good health status, and even they don't have any psychiatric illnesses in the past. Now there is no genetic factors also, she is having one sister and one brother, younger brother and elder sister.